we all got excited about URSO, didn't we?
Yes.
And to my knowledge, I was in the first group of women to take URSO in the UK, and it certainly seemed to be fantastic. It improved my liver function overnight. But of course, what we weren't measuring then were bile acids, although mine were measured all through research and measured retrospectively, and we know they were in the hundreds. And then obviously pitches showed that it wasn't the one we thought it was going to be. It was a bit disappointing. But we've always said alongside that there are researchers who feel that it may still have a use in the management of cholesterol. But I really wanted to just dwell on pitches, that trial, for a little bit, because it was the largest trial in the world. I think it's probably going to be the only trial of URSO in the world. I can't see it being repeated again. I don't know what you think. And we did recruit a really decent, just over 600 women, wasn't it, to that trial. And there's been a few criticisms because some people looked at the data and they've said, well, hang on, they recruited women to this trial who were already on URSO. And so we don't know whether they they stayed on URSO or whether the next tablet they took was a dummy drug. That got to have flawed the data.
Sure. So I'll answer that question first, and then I'll talk a little bit more about pitches. That it's quite clearly written in the paper. It was 5% of women in the URSO group and 4% of women in the placebo, the non-URSO group, that had taken URSO before. So if there had been a marginal hint of an effect and you could remove those people, I think I would be a bit more going, well, the reason that pitches wasn't demonstrating very significant results was because of this, tiny group of people. The honest answer is that pitches, as you said, was the biggest clinical study. wasn't on the pitches research team, so I'm actually not biased by defending my own research. Obviously, I work with a lot of the people who have done, and I know their approach to science and their sort of rigor with clinical trials. But I think what's really interesting to understand is how few trials of URSO had been done before. And it's in a way quite scary. I didn't realise until very recently that there's only just over 1,000 women have been in clinical trials of URSO in the world ever. Wow. And that is not very many women. So to have the confidence to treat women, which I have done since I started as an obstetrician, I have given women URSO. And I don't think I really had the insight to say, I've been doing this based on very small studies with 10 women per arm with incredibly severe disease who were admitted into hospital, for example. When we've actually looked at some of the studies, some of the big studies, they only gave URSO for 2 or 3 weeks. So the only 2 studies that have compared URSO with placebo rather than with another treatment are pitches and pitch, which was another really good trial. It was the one that sort of predated pitches to lay the groundwork for it. I think what is really important to say is that pitches didn't find nothing. Pitches found, firstly, that URSO is safe. And I think for me, that was the biggest relief, actually, to say that we hadn't been giving pregnant women a treatment that could harm them or harm their babies or give them significant side effects. Then the second thing with the sort of benefits, it did reduce itch, but not by an amount that we had asked women before, was the amount that they would feel was worth taking. And I think it's recently, there's been a Cochrane review, which is like a big meta-analysis. It's an organisation that reviews literature to ask clinically relevant questions in an incredibly rigorous way. They've got a very long, strenuous standard that you have to uphold. That's recently just come out, and that has confirmed, yes, URSO does reduce itch, but by a very marginal amount. And it may be an amount that a woman does not feel is worth taking. I think if your itch is at the level where anything, a 1% increase is worth taking a tablet in pregnancy, then it's worth it. And so I think from sort of the symptoms perspective, it's worth knowing that URSO alone isn't, you know, it's not going to fix your itch. If it gets massively better, it may have got massively better anyway, which is what we saw with some of the women taking placebo. With your bile acids, yes, it may drop down, but it may have dropped down anyway, and we can't differentiate between that. But I think, you know, there are suggestions within the Cochrane that it wasn't significant as a reduction in preterm birth, but for women with severe disease, there may be a trend that way. And we're hoping to do some, well, I'm finishing some more research that hopefully will be out in the next 6 months that may really solidify what the impacts are with URSO. So I would say I haven't said URSO is useless. I still recommend that we prescribe URSO to women with very, very severe disease, women with really bad, really high transaminases, because it does seem to improve your ALT, women who are early onset, who are at a higher risk of preterm birth just from the nature that you're preterm. But I think it is important to know there is absolutely no evidence that URSO can prevent stillbirth. So for women who are at an increased risk of stillbirth, the fact that you're taking URSO does not mean that we should ignore the fact that you have got a high risk pregnancy. And I think not being falsely reassured by the fact that you're on URSO is important for your clinicians to know. It's a shame. I wish it could say that, you know, it's going to reduce risks of stillbirth, but there's no evidence to say that it does.